The session would start with recitation from the Holy Quran by Dr. Muhammad Ibrahim Khalilullah.
السلام عليكم. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. صدق الله العظيم.
I would now request Professor Lieutenant Colonel Dr. Muhammad Hamidur Rahman sir to give the welcome speech.
Bismillahirrahmanirrahim. Honorable Chairperson Professor Muhammad Rahman Sir, Chief Guest Professor Muhammad Sarfad Ahmad, Vice Chancellor Bangabandhu Sheikh Mujib Medical University. We have special guest Brigadier General Noor Fatma, Independence Awardee, speakers and delegates from home and abroad. My dear colleagues, Assalamu alaikum. I welcome you to the first international conference Perioperative Cardiac Care, jointly organized by the Department of Cardiac Anesthesiology, Ibrahim Cardiac Hospital and Research Institute, and Texas Children's Hospital, USA. Ladies and gentlemen, congenital heart disease remains a global health problem in many low-income and middle-income countries. Providing optimal care for all these children is a challenging, requires funds and proper planning at various levels of the healthcare system. Advances in pediatric cardiology, cardiac surgery, and cardiac anesthesiology have made it possible to repair or palliate most of the congenital heart diseases, including the complex ones. I wholeheartedly welcome all the delegates. We are also eager to hear from our foreign delegates about their ideas and experiences. It will be a great event to share knowledge between us. Today, we will have some lecture session, and tomorrow we will have a workshop. A detailed schedule of the conference have already been shared with you. We are grateful to our group of sponsors and media partners. I wish you all the best and hope you all have a pleasant stay with us. Thank you all for your presence and participation. I sincerely hope you all will enjoy today's session and tomorrow's workshop. Thank you very much. Assalamu alaikum.
Now I would request Professor Dr. G.M. Farooq sir to say a few words. Sir, you can speak.
Bismillahirrahmanirrahim. Peace be upon all of you. I'll go a little bit back to the first lecture. Dr. Ibrahim was saying Surah Asr. I think it's number 103 Surah. The meaning was not told to you. Meaning means জগন্নাথের কসম মানুষ খুব বিপদগ্রস্ত হয়ে আছে ওরা বাদ দিয়ে কারা বাদ দিয়ে যারা ঈমান রাখে যারা নেক কাজ করে মানুষকে সৎ উপদেশ দান করে এবং ধৈর্য ধারণ করে. It's very important surah for the Muslims who are here to make your life in this fashion. So meaning টা বলে ভালো হইতো. আমি আবার let me speak in English also. This is the promise of God. Allah বলছেন this is this promise of this time. People are in difficulties. except those people who are believer, who does good work, who invites people with good ideas and thoughts, and have patience in difficulties. Anyway, let me, my respected teacher. Side by side. And also I welcome the senior people from USA who have been very kind and nice to come to our country and provide their experiences for the welfare of the pediatric department. And again, welcome all of you here. And I also give my thanks to Dr. Department of Cardiac Anesthesiology, who have been very dynamic to arrange this meeting. And also I'm grateful to all of you for being given the opportunity to talk to you on your behalf. This pediatric cardiology is so important for us as a postgraduate degree. We have got the courses in our institute, which was been very nicely approved by the present VC has approved the MS courses here. MD was there before he arrived as VC. So we have got MD courses and MS in cardiothoracic surgery. And the students to qualify as a postgraduate cardiologist or cardiac surgery, the most important thing is pediatric cardiology or structural heart disease. In structural heart disease is the source of your training in the subject of cardiology. So we have got a very good department of pediatric surgery, and for the cardiology, Dr. Shahid is running this department of pediatric cardiology very efficiently, and our very dynamic and knowledgeable Dr. Selim is doing a pediatric cardiac surgery. So our students in MS and MD will be enriched, will be supported by these two gentlemen for their future career to become a cardiologist in cardiac surgery. Besides that, of course, adult cardiology is also there. And adult cardiology is a part of the cardiology that is being practiced and taught by most of the teachers who are in cardiology working here. So with these few words, I'd like to conclude by saying that, again, welcome to other guests from the outside the institute. My friend is there also, Professor Khalil is a professor of anesthesiology from Heart Foundation. His contribution is immense contribution. Hassan is there, and there are a lot of young people who are working for the Department of Pediatrics all over the country is present here. So welcome all of you. Thank you very much for my giving this moment to talk to you. Thank you very much.
Thank you, sir. Next, I should like to request our special guest, Brigadier General Professor Noor Fatima ma'am, to kindly convey her speech. Ma'am,
Thank you. Respected Chairperson, Mahmudur Rahman Sir, respected Chief Guest, Dr. Professor Sharfuddin Ahmed, and Chief Organizer of this program, Lieutenant Colonel Hamid, and mentor of the MS and MD team, Dr. G.M. Farooq, all the foreign guests and delegates, and all the faculties and students present here. Assalamu alaikum and very good morning to you all. At the very outset, I would like to thank the organizers, especially Hamid Bhai and Dr. Selim, for inviting me over here in this auspicious gathering, which is the first ever perinatal or perioperative international conference. And we should think about this from before, because this is the very important part of the pediatric cardiac surgery. As surgeon, they are doing very hard job. They are working all the day for long surgery in the operation theater. But if they are not managed in the perioperative period, then the result will be zero. So I just want to mention few words in this regard. We know that there are 4 vital life functions. One is ventilation, another is oxygenation, another is circulation, and another is perfusion. So all these life functions are necessary for a human life. And during cardiac surgery, all these four functions are altered or jeopardized because patient circulation is changed into like heart lung machine. So heart and lung stop functioning. Normally when heart stop, we say cardiac arrest and we declare the patient dead. But during the cardiac surgery, same thing happened. Patient maintain the circulation in alternative way from the oxygenator. And then when they return back, then during surgery many things happen. There is dissection, there is conducting system of the heart, and there are many things. Even in the oxygenator there are a lot of change in the blood, especially the blood components like platelets, electrolytes. So there are many changes. So once the patient come back to the life again with the heartbeat, so many things may happen. So here we need a multidisciplinary approach where everybody should be involved, centering the patient. So patient is the center and everybody should be around. So who are this person? The cardiac surgeon itself, anesthesiologist, pediatric cardiologist, then intensivist, then like for the lungs, pulmonologist, respiratory therapies, then even the 5 organs we should consider in post-surgery session, which are like brain, heart, lungs, liver, and kidney. So all these organs should be functioning properly in the post-operative period, and all these specialists should be involved in the multidisciplinary team. So if there is no multidisciplinary team in a post-surgical setup, in post-surgery ICU, cardiac ICU, outcome will be bad. So I would be very happy if we learn something from this conference and then we practice them in our day-to-day practice. Thank you very much. Thank you all.
Thank you, ma'am. I would now request our Honorable Chief Guest, Professor Dr. Mohammad Sharfuddin Ahmed Sir, to convey his speech.
Very good morning. 15 minutes ahead for good afternoon. Respected Chairperson, Professor Mahmudur Rahman, special guest, Brigadier General Nurun Fatima, Professor Farooq Hussain, and Professor Colonel Hamidur Rahman, and all the dignitaries of the dais, especially the specialists from Texas Children's Hospital. You are here, we welcome you, as because you have come here for long way, and you are here to disseminate the knowledge which will be helpful for the patients of this country. In the starting of my speech, I will pay my deep respect to our father of the nation and all the martyrs who sacrificed their life during our liberation war. This is the month of February. I also respect to the martyrs who has sacrificed for the language movement of Bangladesh. Today's session, which is the first international conference of perioperative, means pre, during, post-operative. Any patient that should be cared by everyone. I think these things to be maintained by all the people, not only cardiologists, not only pediatric cardiac surgeon, intensivists, that is anesthesiologists are also very much necessary, and also perfusionists, which we all know. But in our country, perfusionist or pediatric cardiac anesthesia, this is not yet developed much. I think if I say like that, the responsibility comes to me, as I am working for the development of the specialist of this country through my university. You all know all the postgraduate degree or postgraduate specialists are being produced from Bangabandhu Sheikh Mujib Medical University. We have 57 departments. Some of the areas like anesthesia, pediatric cardiac surgeon, pediatric cardiologist, pediatric cardiac anesthesia, all these are still, including perfusionist, there is scarcity. We should increase the number, as because we have a lot of patients, as because our population is much more than 17 crore, that is 16 crore 98 lakh, yesterday I heard it. So there are a lot of patients, but specialists are less. We should increase the specialist. How? If there is no faculty, if there is no specialist, how we can increase the numbers. Where there is the faculties, I have taken decision that in those institute like Ibrahim Cardiac Center, we have already given the MS degree in pediatric cardiac surgery, probably in MD in cardiology, and I think in future pediatric cardiac anesthesia should be here as a postgraduate degree. In this way, we can make the increased number of our specialists. I think nothing is in my pocket. If we can make the decision, if we can plan, a specialist will be increased. Once there was no anesthesia in the country, you know, in the same batch, we have taken 200 anesthesiologists in my university in the same batch. This was the crash program. So in some of the subjects, we should go forward to increase our number. There are 102 courses in Bangabandhu Sheikh Mujib Medical University where there is the MS, MD, MPhil, diploma. In this way, there are a lot of students are there. And about 2,000 doctors every year we are including in our courses, and they are coming up after 5 years. Someone after 3 years, where there is the MPhil, and MSMD after 5 years. What we want to do? Number one, how many manpower is needed? That is a question of research work. By the year 2041, our Honorable Prime Minister has told that we should go for the developed country and the smart Bangladesh. In this region, the health sector should not be behind. We should also move like that. If all the development goes, but the health sector doesn't improve, that will be the disaster for the population of this country. And many people will leave this country for the treatment abroad, and lot of economic loss will be there. This is the diabetic hospital. Once I heard that in our country about 1 lakh crore taka is lost every year for the treatment of diabetes. If we could prevent it, if we could diagnose it earlier among the pre-diabetic patients, many patients would not use lot of economic loss, and our country would be saved, and we can make another Podda bridge with this amount. So we should go for this type of research and prevention of many diseases. I will request my residents, probably someone is here, as because I have already told you that Bangabandhu Sheikh Mujib Medical University has the affiliated many institutes like Ibrahim Cardiac Center and Bardem. I hope the students, they will learn a lot. This type of conference is necessary to gain or gather knowledges. Dissemination of the knowledges will be through this conference, and what we will learn, we will implement it on our patients. That is the achievement of Bangladesh. Many patients goes abroad, 1 or 2 people can learn something. But if the specialist comes from abroad, at a time we can learn 100 at a time. In this way, our training program should be set up in such a way that the training should be at a time for long people, many people, and that will be helpful. I think you all know that our government is giving a lot of amount for the health sector. There are 5 medical universities, including Bangabandhu Sheikh Mujib Medical University. There are about 115 medical colleges in this country. And you will be astonished to know that in Upojela, there are about 9 consultants in Upojela level. And for the population of 6,000, there is community clinic in our country, in the village area. And about 18 to 20 crore people in the year, they move to the community clinic. It means 1 or 2 or 3 times many patients goes there, like about 16 crore mobile are there among the 16 crore population, as because some of them, there are 2 or 3. In this way, the health sector is going. And you see, like metformin, this is also given with 28 drugs in the community clinic, free of cost. So government is helping a lot. I think we should help the government for improving this health sector, and all the patients who will come, we want to serve them with good behavior. If we can move like that, our achievement in the health sector will be much more than other countries by the side. Because they are neighboring countries. In India, you see a lot of people died during Corona. But in our country, we managed very nicely, and the rate of death from Corona was very less. And in Corona management, Bangladesh was 5th among the whole world and first in Southeast Asia region. So I think our government is working hard. All the people in the health sector, they should come forward to help our government. I wish all the success of this conference, and the people who are here, they should learn. I have already noticed some of the residents here. I will say, if you are in front of me, I will ask you what you have learned from this conference. If I ask it, you will learn a lot. That is my idea as a teacher. With these few words, thank you very much for patient sharing. Joy Bangla, Joy Bangabandhu, long live Bangladesh.
Thank you very much, sir, for your nice words. Now I would request the chairman of this session, Professor Mahmudur Rahman, sir, to convey his thoughts.
Very good afternoon to you, Honorable Chief Guest, Professor Saifuddin Ahmed, Honorable Vice Chancellor, Bangabandhu Sheikh Mujib University, our special guest, Brigadier General Nurun Fatima, and my colleagues here, Lieutenant Colonel Hamidur Rahman, Head of the Department of Anesthesiology, and Professor G.M. Farooq, and also my colleagues, friends from abroad. I wish you all well. As a chairperson, I've got very little to add to what you have already heard, particularly from our Vice Chancellor, Professor Saifuddin. The achievements made in the past 10-15 years are tremendous, and I hope the march in knowledge gathering as well as in service delivery will go forward. The only thing I like to add here is that individually, all doctors and budding specialists should keep one thing in mind, that nowadays, in the period of specialization, the teamwork of different faculties and different specialties are much more important than before. Specialists, generalists are no more there. It's all specialists in various subjects and various organs. But the human body is dependent on one to another organs. You just cannot keep your lungs happy and liver fail. You have to match the balance of all the vital organs. We've heard from that before, that the cost of healthcare also going up. Man is mortal, but the ultimate idea of physician or a surgeon or anything is to keep the man happy and healthy as long as he lives. So if we keep all this in mind, particularly to my younger friends, I hope the healthcare system will keep on marching forward in this country. We'll have many more conferences like this, exchange of ideas, learn from others, and keep our academic atmosphere healthy. With all these hopes and ideas, I congratulate you all for staging this event, and particularly our friends from Texas Children's Hospital for coming and taking the trouble to render their expertise and also discuss and help to build a better future, not only for Bangladesh, but for the humanity as well. Thank you very much.
Thank you very much, sir. We are nearly at the end of the inaugural ceremony. I would now request Professor Dr. Shirazul Islam, sir, from Department of Cardiac Anesthesiology, ICRI, to convey the vote of thanks.
Assalamu alaikum and good morning to all. I feel honored and privileged to get the opportunity to propose a vote of thanks of this special occasion. I, on behalf of the organizing committee, convey deep regards and hearty thanks to our Honorable Vice Chancellor, Bangabandhu Sheikh Mujibur Rahman University, Professor Dr. Sharfuddin Ahmed, for kindly accepting our invitation and gracing the inaugural function. My sincere thanks to Professor Brigadier General Dr. Nurun Nahar Fatima, Independence Awardee, for her presence in our conference as a special guest in spite of her busy schedule. I am thankful to our teacher and chairman, Board of Advisors, Professor Mahmudur Rahman sir. I would like to thank our Chief Executive Officer, Professor M.A. Roshid, for his constant help and guidance that radiates a source of energy for us. I am very much thankful to our current faculty colleagues. I thank all plenary speakers, moderators, and delegators for their enthusiastic participation in this conference. I am very much thankful to all sponsors of the conference. Without their generous financial support, it would not have been possible to organize the conference. It will remain incomplete if I do not mention the name of Dr. Muhammad Rukunuzzaman Selim, Associate Professor of Department of Cardiac Surgery, Ibrahim Cardiac Hospital. It was quite impossible to organize this conference without his great cooperation. My thanks also go to all the people who have given their precious time. I would like to acknowledge and thanks our Human Resource Department for their logistics support, IT sector for technical support, and cafeteria for arrangement of food and refreshment. If time is money, then today you have spent millions for us. Thanks to all. Thanks to all of you for making this event successful. Thank you.
Now it is time to hand over a little memento to the honorable guests as a reminder of this experience. I would now request Professor Dr. Mahmudur Rahman sir to kindly present the memento to Professor Dr. Muhammad Sharfuddin Ahmed sir. Now I request Professor Dr. Sharfuddin Ahmed sir to present the memento to Brigadier General Professor Dr. Nurun Nahar Fatima ma'am. Once again, Professor Dr. Sharfuddin Ahmed sir is requested to hand over the memento to Professor Dr. Mahmudur Rahman sir. That brings us to the successful completion of the inaugural ceremony. We will shortly start our next session. Thank you all for your gracious presence and patient hearing.
Thank you so much.